from Amanda Austin, the NFIB Director of Federal Public Policy. And of course, the NFIB stands for the National Federation of Independent Business. In other words, small business, or as I like to call it, essential business. Amanda, we welcome you to America's Forum.
Great. Thanks so much for having me today on such an important issue.
You bet.
Hi, Amanda. Thanks for joining us. Now, I do want to ask you right off the bat, I believe you heard the quote we just had from Chris Van Hollen. He has been supporting Obamacare for quite a while. What do you think of what he had to say?
Well, you know, I try not to laugh because, frankly, business owners, all they're seeing with this healthcare law are new taxes, and new mandates. A law that they claim is supposed to help small business and sole proprietors and individuals couldn't be further from the truth. And we've seen that now through delays and exemptions and changes in the law. I mean, it's just flat out not working. I think directly related to this issue that you gave a fantastic report on, just this provision alone in 1,000 to 2,000 pages of this law is going to cost employees, business owners, employees, because it's all one big pot, $500 per head per employee on an annual basis. And that is the sort of the minimum. That's the floor because this tax increases every year. So I'm not sure what type of numbers he's looking at, but it's not shaking out with what we're looking at.
You know, and it's a bit of a follow-up. Our report is really focused on small businesses, but I'm wondering about the actual consumer. I mean, are my tax bills going to go up? Are we going to see a lot of this break down to the consumer?
I think most consumers are going to see their premiums increase when we're talking about healthcare costs. I just do. I mean, you know, this law puts in new mandates on individuals and businesses. It requires more health benefits included in the insurance plan that you purchase. And the way it sort of quote-unquote pays for itself is it's got a handful of new taxes that basically most all consumers are going to be paying in the long run. So, you know, they're sort of demanding that you get the Cadillac when you just wanted the Corolla.
Well, Amanda, love the acronym. I don't think the administration likes it too much, of health insurance tax, or the HIT, because so many people are taking a hit. But if you could, we've been concentrating on the so-called health insurance tax. You alluded to more taxes being part of Obamacare. Can you give us more of a breakdown of what those taxes are that consumers and health insurance recipients will face with the implementation of Obamacare?
Sure. I mean, you've got everything from the bottom up. You've got a tanning bed tax related to it. You've got a tax on individuals who do not buy health insurance. You've got a huge tax on employers through the employer mandate that if you do not offer insurance to your employees and are considered large by you know what constitutes this law, which is 50 or more employees, you're paying either $2,000 or $3,000, not deductible to the employer, per head on an annual basis per employee. The list goes on. You've got some new Medicare taxes included in there. You've also got the health insurance tax. You've got the medical device tax. It's just, and then you've got a tax on what they would call a high earner tax. It's just, I mean, when you look at what this bill costs the American public, they basically had to tax everybody to get it passed. And this is just, you know, one of the issues that we're talking about today that we're going to end up having to pay for.
I mean, some of this just seems ridiculous. What types of small businesses and firms do you think will be hit hardest?
You know, I think everybody's going to be hit generally across the board, but I do think small businesses are probably going to be hit the most. I mean, you look at sort of large corporations and unions, they're much more nimble than the general small business owner is, you know, with the complexity of regulation and their ability to sort of absorb an impact of a $2,000 or $3,000 hit is not the same on par as some of your bigger Targets or Walmarts or so on. So you're looking at the mom and pop, 15 employees, 20 employees, 25. If you ask them what the most unpredictable cost they have on an annual basis is, I guarantee you those that are offering health insurance covers are going to say, it's my health care premium. I don't ever know what it's going to be year to year, and it's the cost. I cannot condition myself to know what I'm going to be paying. With this law, it just completely exacerbates that issue, and that's why we are so sensitive to every nook and cranny in this law that affects business, because at the end of the day, it comes out of one bucket, and it's going to be an enormous cost.
Amanda Austin, the Director of Federal Public Policy for the National Federation of Independent Business, we thank you for your take on this hit, the health insurance tax. And Morgan Thompson, we thank you for your reporting. People need to know about it. Your thoughts on the added taxes of Obamacare, we'd love to hear from you. Tweet us at NewsmaxTV, #America's Forum. There's also email and Facebook. We'll face you again in just a couple of minutes.